Most types of post-pregnancy pains don't last long, but for our next guest, not only did her pain last years, it went misdiagnosed.
I was a triathlete for many years. I ran competitive 5Ks. I was a fitness competitor. When I had my first kid at age 24 is when I first started to notice the pain, and at the time, I really just thought it was my tailbone. I was misdiagnosed many times. I was told that I had degenerative disc disease. When I went through my second pregnancy, I was 35 years old, and I had twins, and they were 7 pounds each. After that pregnancy is when things really started to get worse.
So I probably went to 10 to 12 different physical therapists.
A lot of times I couldn't even bend over to brush my teeth. I would get steroid injections. I even had SI injections directly into my SI joint. And I had maxed out the number of injections that I could get. It was probably the last 15 years that I really struggled trying to find someone to really figure out what was going on with it.
My last physical therapist was able to pinpoint that it was coming from my SI joint, and it was kind of like an aha moment.
Everyone, please welcome Jaime to the show.
Welcome.
Jaime, I'm sorry you went so long not getting the proper diagnosis and suffering in pain. Ultimately, you got the correct diagnosis. Can you talk a little bit about that and then what you did next?
Once I did finally figure out that it was my SI joint, I started doing my own research and trying to figure out, what I could do about it, because, I couldn't really find a doctor that could figure out what was wrong with me. So I took it upon myself to really use Google and go and do my own research and find a procedure that was going to help me.
Well, we're also joined today by orthopedic spine surgeon Dr. Moghimi. And let's talk just briefly, if we could, about how common women might end up in a position like Jaime.
We think somewhere around 5% of all pregnant women probably have some type of sacroiliac pain or dysfunction, but more importantly is like the general population as a whole has lower back pain. I mean, about 80% of people have lower back pain, and there's about 30 million people living with chronic lower back pain. Of that 30 million, maybe 10 to 30% have SI joint issues. Until doctors and patients kind of really recognize SI joint as an issue, it's going to continue to grow.
And I'm just curious about how you helped her. Tell us about what you did.
If you fail conservative treatment, the surgical option you can do is a minimally invasive surgery, something called a minimally invasive sacroiliac fusion. And I use this iFuse system. And basically, just like a joint anywhere in the body, the hip or the knee, you have two bones that normally move. You want to stop them from moving, and then it won't hurt. So you can drill across the joint and create a path, and then place a triangular implant across the joint. That triangle stops the joint from moving, and then if you don't move, it doesn't rub, no inflammation, no pain.
But can you do this if you're planning to get pregnant again? Because once you perform that fusion, wouldn't that be difficult with the subsequent pregnancy?
Yeah, in general, that's kind of a contraindication for doing the procedure, is because you will lose the ability to kind of get the pelvis to expand. So you could have to have C-sections if you have that procedure, especially bilateral, both sides.
All right, Jaime, how are you feeling?
I feel great. I mean, it's like a new lease on life. I mean, as soon as I got the surgery, it was super easy. I was in and out of the hospital really quick. I got home, spent 6 weeks on crutches, but I could immediately sit up, like even in the bed, which I couldn't do before. I couldn't sit in a chair for, a couple of years. And I mean, now I'm, boxing, I'm lifting, I'm running, I'm spinning, I'm yoga, I'm coaching my daughter's soccer team, which it never would have dreamed I could be able to do.
Good for you.
Yeah.
So
That's a lot.
So, Doc, no limitations after doing the fusion. She can go back to everything she was doing, and it sounds like even more.
Yeah, correct. I mean, right immediately post-op, we try to restrict their weight bearing a little bit, give the bones a chance to heal. After that, once the bone is grown, yeah, sky's the limit.
And I would love for our control room, if you could, just pull up that image again of the sacroiliac joint. And I want everyone at home just to look at this area, because there are a lot of people out there who don't understand. It's in an area that's slightly different than your traditional low back pain, and yet a lot of people aren't familiar with it. And if you notice that your pain is kind of right where that sacrum and ilium meet, you may have to even be with your doctor and say, hey, this is different than anything I've had before. And really try to get the correct diagnosis, because if they just keep treating you for back strain, you're not going to get the proper treatment. Yeah. We're just very happy, Jaime, that you have the fix that you needed.
Yep. And that you were your own advocate and you were able to figure this out. So well done.
And sorry it took that long. Dr. Moghimi, thank you.